Hello and welcome to MedEd Media. My name's Luke Farmery and I'll be giving today's screencast on how healthcare students and professionals can use social media to benefit themselves and their patients. We felt it was high time to produce this screencast in view of the previous screencast we've already given on what not to do online. And we felt we needed to give you some incentive before going on to watch our other screencasts on the guidance that's available to students and doctors in the UK. So the first advantage we've come up with is communication, which is probably the obvious one. There's an ability to communicate peer-to-peer, or doctor-to-patient, or senior to junior, or junior to senior. So there's many dynamics to this communication forum. Also, another advantage is that remote areas can access the advice of specialists, which is an advantage that's already shown in that research done on telecommunications. The second advantage we've come up to is staying up to date. Things like Twitter produce news feeds and trends where people can follow topics they're interested in, and this can include research topics or just common tags to do with healthcare, or even flu outbreaks have shown up in Twitter trends as well. Staying up to date also includes the accessible information. The internet is all about having accessible information, and these might be via blogs or RSS feeds, which we'll come onto in later screencasts. Medical education is another advantage of the social media, the ability to run study groups online. I ran one in my finals on Facebook with a group of similarly minded students. There's also the ability for Twitter discussions using hashtags, which we'll come onto in future screencasts as well. There's also YouTube videos and a wealth of educational videos on YouTube showing clinical examination skills, as well as teaching basic science. And there's also the specific educational websites that you can find: doctors.org, New Media Medicine, Meducation, and others that I'm sure are out there. There's also a possible clinical benefit to social media in terms of health promotion and accessing a cohort of patients that might not otherwise have been accessed. For example, people that don't attend their GP but do spend a lot of time on the computer. There's also the ability for health monitoring via devices such as computers, tablets and mobile devices, and the phenomenon of gamification, where things like monitoring blood sugars in diabetes are turned into apps and games on mobile devices to encourage users to use them. And then there's a potential benefit in crowdsourcing diagnosis, where people can put up obviously anonymised information online about a case they're struggling with and receive input from several doctors or specialists to reach a difficult diagnosis. We also value the feedback and appraisal that social media can provide, and feedback is already a very important part of medical education and continuing professional development. And I think that the future social media may provide a further avenue to the systems we already have in place for feedback and appraisal in medical education. So again, thanks for listening to this screencast. My name's Luke Farmery. I'm a junior doctor with a special interest in the use of social media in medicine. If you'd like to contact us or me, all our contact information are on this slide. Thank you very much for listening.